Welcome to the 5th episode of PKRG-TV's Well-Being series. I'm your host, Lori Fredrics, and I'm delighted to welcome our guest, Karen Overgaard. Karen is a licensed practical nurse specializing in holistic medicine with over 35 years of clinical experience. Her nursing expertise includes internal medicine, pediatrics, and midwifery. As part of a holistic approach to improving her patients' well-being, Karen became a Reiki master and registered yoga teacher and is certified to work with children, trauma, addiction, and cancer patients, as well as veterans suffering from PTSD. As an infant massage instructor, a lactation specialist, and postpartum doula, she is dedicated to helping new moms and their babies to thrive. While Karen's holistic health and nutrition counseling can improve her patients' well-being, it is the self-care skills which Karen practices in her everyday life that form what Karen teaches her patients to develop so that they can learn to heal themselves. Our program today will provide a broad overview of holistic medicine practices with demonstrations of several self-care healing modalities so that you, our viewers, can learn about how these techniques can help to improve your overall mind-body wellness. Karen, thank you so much for being with us today.
Thank you for having me, Lori.
So, I am so enthused to speak to you about holistic medicine, and I'd like to begin by asking you about the difference between traditional medicine and holistic medicine practices, and also maybe get an idea why you as an LPN decided that this was going to be your area.
Well, holistic practices, the practitioner is more apt to go for a natural approach. Depending on what the issue is, what the ailment, if you will, is, instead of going directly to a prescription, if the diagnosis or ailment would be anxiety, they might say prescribe yoga, yoga breathing, homeopathic remedies that might be a natural remedy. Instead of going to, again, a prescription medication, they might prescribe something like gelsemium. I mean, these are homeopathic remedies that are natural, that have no side effects, things like that. That's what they might provide. Instead of an antidepressant or something like that, they would do that.
And so what made you first start to get interested in this?
I love everything natural. So as a child, we went on vacation up to a lake house that was removed from everything. My brother got severe poison ivy, and there was nobody. There was no urgent care at that point.
There's nothing worse than severe.
It was severe. There was nothing around, so we went to a general store, and at the general store, they took us in the back, and they had something called either silver leaf or jewelweed, and it's like an aloe, and you'd pop the stem and apply it directly to the skin, and then it cleared it up. Otherwise, it would have been steroids and everything else because it was severe, and it really, really did work. To this day, I have silver leaf or jewelweed in my yard, and people stop by to pick it to apply to their poison ivy. It really is just soothing. The name silver leaf came from, if you took the leaf and put it underwater, it turned silver. But it's also, again, like I said, known as jewelweed. Right. And I like anything natural.
Me too. So holistic medicine practitioners use traditional medications as a component of their treatments, right? So that's just part of it?
Well, it depends what kind of a holistic practitioner they are. Now, if they're an integrative practitioner, they integrate natural remedies with traditional, and but they have to be licensed. So if they're an MD, an NP, a DO, they can all prescribe traditional medications.
Right, okay. So what sort of training do holistic medicine practitioners undergo?
Well, that varies, again, on what kind of a holistic practitioner you are. It could be, again, if you're integrative, you go through the traditional medical school and what other holistic courses there might be. If you're acupuncturist, you have to go to acupuncture school. As a Reiki master, I went through a lot of training over the years, to become a Reiki master. The best way to find a practitioner that you are comfortable with is to go, by word of mouth, and there are different associations and societies and groups that can recommend, people that are competent and that you would feel comfortable with.
So I see by your bio that you do a bunch of different things,
Yes.
right?
Yeah.
And that we'll get to. What are some of the trainings that you have undertaken?
Well, I went to the Integrative Institute of Nutrition, and that's how I became a holistic health counselor. That was in New York City, and that was a lot of fun. It was a year-long program. And for my infant massage, I went to the Swedish Institute. That was a long weekend, and we had a test, and we had to read a lot of books and have clients. Most recently, I became a postpartum doula. So that was a week-long course online. Then we had to read 13 books, write a paper, have 3 clients, get evaluations, and a few more things. And then after that, we had to, that is what it took to become certified. And then there's a whole doula network, and that's how you get people that you are,
Interesting.
Yeah.
So what are some examples of holistic medicine treatments that are not normally offered by traditional medical practitioners?
Acupuncture, Reiki, yoga. When they integrate, that's when they bring it all into their traditional practice. But as a standard Western medical practice, they're not going to, that won't be a part of it.
Chiropractic?
Chiropractic, so actually I have been working with a chiropractor, and they do, in their physical therapy, they have massage, which is another great thing.
Yes.
And
I will
Reiki,
attest to that.
And Reiki is part of it, and some of their physical therapy, their stretching, and their exercises for physical therapy are yoga stretches, so it's great.
Right.
Yeah.
There isn't sort of like a place where I think the PT stops and the yoga starts.
Exactly.
I think that there's a bit of an overlap with that.
From personal experience, I had a back issue, and I went and they showed me all the stretches I should do, and they're all that I knew from my yoga practice. I knew them all.
Right. Well, I know that in my own experience, going to, for example, a traditional doctor for a back problem, I'd say, oh, do you think that a chiropractor can help me? Because this medicine didn't help me, and this,
Yeah.
And they're like, well, I can't really suggest that.
That, I think times have changed with that.
Right, okay.
Times have changed
Good.
appreciably with that. And I know myself, years ago, I was like, I'm a little afraid to go to a chiropractor. Now I go once a month, just for a little tune-up. And it just feels good.
And is Chinese medicine something that holistic medicine practitioners employ?
I think that you have to be specifically trained in Chinese medicine. So I would say no, traditional.
Okay.
Yeah.
Okay, so that's its sort of its own thing then.
Exactly.
Okay.
Exactly.
Right.
I will say, again, back to the integrative practice, that sometimes there's some Chinese herbs that they are versed in that they will prescribe.
All right, so how...
Or suggest, I should
Okay.
say. They don't prescribe Chinese herbs. Yeah.
Right. So this is probably something kind of central to what you do. And so my next question is, how do emotional and spiritual issues impact on physical well-being? And how do holistic medicine practitioners support the emotional and spiritual well-being of their patients?
So it is pretty well known that if you are stressed and anxious and just beyond, that it affects the immune system. And when the immune system is down, that's when you get sick. How it is supported, again, I do Reiki, and Reiki is a very hands-on, calming, centering modality, massage therapy, yoga breathing, stretching, meditation, all these things calm the system. And when you're calm, then the immune system is working well. As soon as that immune system gets affected, then that's when illness jumps in.
Absolutely. I've
I've
definitely
of course.
experienced
I've seen it
that,
on my friends. I've
right?
seen it on people.
And as we discussed before, it's people, it's animals. Stress definitely causes all kinds of underlying things to come forward.
I know people who eat healthy, they don't drink, they don't smoke, they exercise regularly, but something in the family goes a little kaflooey, shall we say, and then they get sick.
Yeah.
Healthiest people in the world, they do everything right, and then there's, like, again, a family illness, and then their immune system gets affected, and then they get sick.
So holistic medicine, isn't that thinking of the entire person rather than just specific things?
Just the specific. It's treating the whole body,
right.
Mind, body, and spiritual. Mm-hmm. Yes.
And today's medical practices, I mean, often we find so many specialists.
Right.
Don't we?
Yeah, specialist in everything. You go to a general practitioner, and I know from my own experience, I go to a general practitioner, and they'll tell me like 3 different people that I need to see specialists besides them, and I'm like, and why would that be? Because back in the day, you had a general practitioner. My doctor, when I was growing up, took my tonsils out in his office.
In his office?
Delivered babies, and he was the general practitioner for the family. That's no joke.
Right.
Yeah.
No,
Do you think I'm dating myself?
No, but I mean,
Yeah.
as someone who has...
it's a whole different world now.
As someone who has shadowed ENT doctors, I find it very interesting that someone would decide to take tonsils out in their office.
But this
boy.
was a long time ago. I can remember it clear as a bell. Obviously that wouldn't ever happen again.
Yeah. Well, I love the idea of thinking of a person holistically and thinking of treating an entire person, because I personally have found that when you do go to specialists, in my own experience, bringing family members to specialists, you go to, I'm going to speak again because it's my area, you go to a laryngologist and they think of you as a set of vocal cords, right?
Exactly.
And then you go to gynecologist or obstetrician, and they think of you as a uterus.
Yeah.
And they're right.
That's right.
Right? And there might be something that's affecting your vocal cords and a medication that might, affect another part of your body, right? In another way, unless you're thinking of the whole person.
Everything is connected. And that would be like, now I don't know a tremendous amount about acupuncture, but the different meridians that they will put their little acupuncture needles in, which is something in an area that's totally not what you would expect. Do you know what I mean?
I have had some acupuncture, and I actually have a friend that I went to music school with who became a Chinese medicine doctor, and she says there's a bunch of patterns that they learn.
Right.
And I don't know if that's neurological or why, but I do know that it works.
Right. In other words, if you go in with a complaint, the area that they're putting their acupuncture needles in is totally not where you're complaining. So it affects that area. But
it's in the person.
Exactly. And it is about the whole person, because everything's related, everything is connected.
Right. Well, let's talk a little bit about osteopathy. So what is an osteopath, and how is their approach and training different from a traditional MD?
Actually, it's not. They do a different schooling, but it's a long, several years. And I mean, I've worked in group practices where there's an osteopath, and she prescribed. She did not do anything different than the other MDs did. She did prescribe.
And that's in the United States.
Correct.
Because we talked a little bit about my experience in Europe, where the osteopathic doctors, they adjusted kind of like a chiropractor, but with the osteopathic particular adjustments.
Yes.
And they would never be prescribing anything to anybody.
Well,
right.
The chiropractors, they can prescribe testing, MRIs and, blood work and things like that, but they can't prescribe medication.
Right, they can do investigative.
Yeah, and they do their
things.
adjusting, and I
Right.
have had very good experience with them.
Right, okay.
As I say, it took me a number of years to do that, but they're wonderful.
Yeah, so my next question is about a modality that I have personally found really helpful, right? So can you explain how massage can help to improve physical as well as emotional well-being, and what makes it especially and uniquely effective as a treatment for infants, which I just found out about infant massage when I was
amazing
looking up,
stuff.
right?
It's all amazing. So massage is fabulous. So how massage affects you is first of all, they just massage you and the whole action relaxes you. When you're relaxed, then everything feels better. Then if you're not in pain, then that helps you emotionally and physically. It's just a great thing. I know I've gone in with all kinds of aches and pains and stress and angst, and I come out like, oh, well, that was really good. And no medication, it just felt really good. So
Absolutely.
With infants, I've taught infants since about 2000, infant massage. I don't teach them. I teach the parent how to give the baby a massage. And since about 2004, that's when I took the course. And for the babies, it's good for circulation, it's good for digestion, it's good for body awareness, it's good for bonding. It's excellent for the parent, because I've had a lot of very stressed out parents that have come into the class like, oh, the baby won't stop crying, and left the class like, oh, because there's little techniques that they can do that bonds them with the baby. The other part of that is if I have a decent sized class, or even more than one person, the parent can relate to the other parent, and that is also very relaxing. Oh, your child does this too? Yeah, okay, and then you feel better. It's like a support system. But I think it's a good tool to have in the toolbox at 3 a.m. when your baby's crying inconsolably and you're like, I don't know what to do. Just try these little massage techniques, and it could work wonders. It's great.
Yeah,
I love it. It's one of my most favorite classes to teach. It really
I mean,
is.
I can really imagine why it's really helpful for the parent to be massaging the baby, because the baby is going to respond and be more relaxed with the parent that the baby knows. Because when
the baby relaxes, you relax, or when you relax, the baby relaxes, because we do project.
Yeah, absolutely.
Yeah.
And having body work myself, I mean, I've had the practitioners say, that part of what makes it work is when you are allowing it to work, and when you feel relaxed, and you're actually participating in the letting go and all that.
Sure.
And I can imagine that babies are going to trust their own parents rather than some stranger coming in and starting to.
There is scientific proof. My teacher that I took it from, she would go annually to Romania, to the orphanages.
Wow.
And there were babies there that were in cribs. I mean, babies, like 3 years old. They never left the crib. They never got any hands-on, nothing. And there are scientific studies that their brain developed slower. They had many, many, many issues as they grew up. There is also another one about preemies, and let's say three got infant massage, 3 got nothing. Those 3 gained weight faster, their brain developed quicker, and it's amazing. It's just fabulous. I've always believed in touch. Touch is healing, and it definitely is.
I agree with you. All right, let's switch to another modality, I guess, which I am also really interested in. What role does nutrition play in maintaining and enhancing overall well-being?
Well, there's that old adage, you are what you eat. And, obviously just a balanced, clean diet is best for everybody. With certain disabilities or whatever, let us say with somebody with ADHD, they should no sugar, nothing processed, no dyes, no red dye. That would be something. If everybody ate well and clean, you'd be feeling a lot better. There's a lot of health issues that are related to the diet. Some people find out that they have a gluten sensitivity, and they cut it out, and the world is a different place. Obviously, sugar is not good for anything, even though we all tend to have a little sweet tooth. But just clean, unprocessed food, it affects the mood. You know, it affects physically, it affects everything. I mean, let's just say sugar. Somebody that consumed 3 donuts, and they're like,
that's a lot of donuts.
They're all okay. Just an example.
I only need half a donut.
All very, very, very. You know, they're like wired for sound. Like they're on a sugar high. Well, then they go up, and then they crash. And then, of course, the thought is, well, then I need another donut, you know, and then they go up and then they crash. So it has to be balanced. You know, you can't, that's just not a good thing to do. It's not caffeine, alcohol, none of it's good. You know, and I always say everything in moderation. So if you want to have a cup of coffee or something like that, but not to overdo it. I mean, some people drink whole pots. And sugar. I
might be a little bit guilty of that.
I'm not pinpointing anybody. I'm not selecting anybody, but yeah.
I tried to give up coffee once.
Yeah.
That didn't work out for me. And I also realized, you know, dying on the road, having a car accident instead of being awake wasn't going to be good for my well-being.
Well, yeah, you have to pick your poison, as they say. Yeah,
exactly.
But everything in moderation. So as balanced as you can, as organic and clean as you can, and you have to read labels. You've got to read labels, because even let's per se, if you were on a gluten-free diet and the package says gluten-free, then you read the tiny, 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 tiny ingredients, and it will say that they can still allow a certain percentage of gluten in that item and label it gluten-free. Yeah, right? Dyes, you want natural dyes. You don't want red and blue and, you know, yellow. None of it's good. Right. And when you can't, you know, and then this probably stems into another question, but vitamin supplements are not a bad thing, but if you can get it all in your nutrition, in your food, you don't really need the vitamin supplements. I do take vitamin supplements because it's a little difficult sometimes to fit all those servings of vegetables and fruit into your diet in the day. So there's a time and a place, but just eat clean, eat healthy, and that's it.
All right. Okay. So what role does self-care play in healing and maintaining well-being, and what can our viewers do on their own in addition to visiting a holistic medicine practitioner?
Self-care is imperative for everyone, regardless of what your point in life is. It's if you're a primary caregiver for an ill relative or friend,
as I was for 5 years.
There you go. If you're a parent and have kids, if you have a stressful job, anything. If you live in this crazy world that we live in, you need to take a moment out for yourself and do some self-care. I have a couple of little suggestions and tips that you can do, but just if you take 5 minutes a day out for yourself, you either do a yoga stretch, you do a breathing technique, you take a walk around the house, I have myself, sometimes I'm like, all right, I cannot do another thing. I've got to stop, and I'll just like lay back, lay down, kind of let everything loose for 5 minutes, not even necessarily fall asleep. And then I'm like, oh, I'm renewed.
It's like putting on your own oxygen mask before you can help someone else.
That is exactly it. That's exactly it. You cannot take care of anybody else if your cup is half full, as they say.
Good. So then maybe you can show some of our viewers a few exercises that they can do at home.
Yes.
All right, great.
Yeah.
Well, let's go do that.
Yeah, okay, sounds good.
Right.
So just a few simple stretches and breath work that you can do that help yourself, that de-stress yourself, and that don't take long. You can do it seated outside like I am in nature, which is wonderful. You can do it at your desk chair. You can do it on your yoga mat. You can do it wherever you are. Okay, so first thing is you take a big, deep breath in and blow it out through your mouth. And repeat that inhale up. Exhale through the mouth. And one more time, inhale up. And exhale through the mouth. Now your shoulders, raise your shoulders up with an inhale. Exhale and release. And inhale. Exhale and release. And one more time, inhale. Exhale. Now place one hand down next to you. Inhale, take the opposite arm and do a side stretch. Stretch out that side body. And back to center, other side. Inhale, exhale, and stretch. And one more time each side. Inhale and exhale. It feels good on your side body. And the other side. Inhale and exhale. Now take your right hand to your left knee. Inhale and take that left hand behind you. Exhale and twist to look at your fingertips. It's excellent for your spine to stretch it. And back center, other side, left hand to right knee. Inhale your right hand up. Exhale, place your fingertips behind you and look at those fingertips and breathe into the stretch. And come forward. Now crisscross your hands. Take a breath in. Exhale and just come as far forward as is comfortable for you. And just try to let your head hang. And roll up. One more time. Inhale. Exhale and just fold forward. And roll up. Shake it out. Interlace your fingers together. Inhale up. Exhale, curl. Inhale, arch. Exhale, curl. Inhale, arch. Exhale, curl. And one more time. Inhale, arch. Exhale, curl. Okay, now hands on your hips and just do little body rolls. To the right, circle. Works out all the creaks. And circle. And circle and reverse the circle. Feels so good. You never know what needs to be stretched until you stretch it. And circle. Okay, back center. Now we're going to do a little self-massage. We all need a massage, and you have it at your fingertips. Rub your hands together. Create a little friction. Place your hands on your sinuses, on your sinus area, and just massage. And then the top of your head, massage your scalp, dig those fingers in. And the back of your neck. Opposite hand to opposite shoulder and just work down. Just dig in. Right hand palm up. Tug your fingertips with your opposite, stretch that out. Other side, stretch that out. Shake it out. Now, 3-part breath. Amazing, it's an amazing, very relaxing technique. I teach this to everybody. So just for demonstration purposes, put your hands on your stomach. Inhale, inflate your stomach. Draw the breath up to your ribs. Up to your chest and collarbone. Hold, 2, 3, and then exhale it all out through your mouth. So do it at your own pace, but inhale, fill your tummy up. Draw it up to your ribs. Draw it up to your chest and collarbone. Hold for 3. And you exhale it all out from top to bottom. 2 more times. This, if you count the cycles, and 1 complete cycle, and then 2 complete cycles, and you just focus on your breathing, and you're in charge of your breathing. So that is, in itself, it's very relaxing. And usually if I tend to wake up at 2 and stay awake till 5 and need to get up at 6. So I do my 3-part breath, and after probably 3 cycles, I find that I fell asleep. So it's a great thing. So try it 1 more time, or 2 more times. Hands on your tummy, inhale. Draw the breath up and higher, hold. One more time. Inhale, and up, and up, and hold. Just let it all go. At one point that you wouldn't do the hold part, the retention, is if you're pregnant. You don't do any breath retention during pregnancy. And the last thing I want to do is a peace meditation. So you can do this when you're seated, when you wake up in the morning, or when you first go to bed. So I'm seated. You can do it lying down. Okay? So first thing you do is get grounded. Just focus on your own breath and close your eyes softly if you can, and just focus on your breathing. And you take your right hand, put it under your left arm, your left hand under your right arm, and just focus. Focus on your heart center. Just notice the harmonic breathing. Focus on your heart and all the love and peace that's there. And just remain in this position for just a few minutes. And just focus, let everything go. Focus on your breath and your heart. And when you're ready, you can slowly release your hands, palm up. And slowly open your eyes. And just take a nice breath in. And exhale it out.
So, Karen, what does a midwife do that a traditional doctor doesn't do?
Well, a midwife, obviously, they're with the mom, prenatal, at the birth, and postpartum. They do much the same. However, I believe the midwife takes a more natural approach to the entire birth process. And postpartum, they see the patients often. Depending, again, if there's an issue of postpartum depression, then they see the patient several times and refer out and see for follow-up. Other than the fact that they take a more natural approach and a more relaxed approach about the whole birthing process, and they look at things just a little bit differently, I would say, than the traditional OB. They are probably less reticent to advise a C-section than a traditional OB. Obviously, if there's one warranted, they will, they would advise it, but I think that would be, a difference.
Do they sometimes work in tandem with a doctor?
Yes. If we have high-risk patients, they refer out, and if a C-section is required, they are there to assist.
So my next question that I've been wondering about is, what is a postpartum doula and how is that different from a midwife?
Well, we don't deliver. And there's birth doulas, which I am not, and there's postpartum doulas. So a postpartum doula's role is to make the transition of bringing a new baby into the home smooth and supportive for the whole family. It could be showing her breastfeeding, bottle feeding, bathing the baby, giving her some time to do some self-care, taking care of the baby. If there's other children there, then she could take care of the other children while mom has time with the baby. Meal planning, light housekeeping, all those things,
Right.
just to make it easier because it's a big change.
Yeah. Well, I'm not a mom, as we discussed, but in speaking to moms, a lot of times they've said something to me like, this baby didn't come with instructions.
That's exactly
and
it.
what am I going to do? And like, people bring a baby home, they're a mom, they have this baby, but they don't have really expertise, and they start calling their mother, they start calling their friends.
Right.
They're getting all different kinds of advice, but
Right.
not expert advice. So maybe
That's
doula
where the
is
postpartum doula comes in.
Right, okay, well,
Because a lot of people come home and they get a little more than they expected.
Well, when I went to look up some information about that, before talking to you, what I found out was something really interesting, that the Japanese government actually provides a postpartum doula for all new mothers.
That's excellent. That's excellent.
So wouldn't that be great?
It's an amazing culture. Yeah.
Yeah. Wouldn't that be great if that were? I mean, I think that they talk about not everybody accepts that, because I guess some people were thinking, I don't want,
Yeah.
But they get that, so. I actually really love that.
Yeah, no, that's amazing, and that's really a great thing, and it definitely does not happen here.
Yes, right.
But they have a whole different, the mom rests for 40 days. There's different broths, hot broths, and things that she gets. It's a whole different culture.
Yeah, and this brings me to my next question, which is, obviously support, getting support in your care. Are holistic treatments covered by most medical insurance, Medicare, and Medicaid?
I would say for the majority, no.
Okay.
I believe some insurances are now covering acupuncture. Some maybe massage, but as far as I know, maybe nutrition. They're all different. There's such a variation of coverage on all different plans. I always tell people to call your 800 number on your card and see what's covered. Also, that's another way to find a practitioner. You call that number on your insurance card, and they have a list of people that they cover and refer to.
Right. Well, so that brings me to my next question, which you sort of addressed a little bit, but how do you identify qualified and reliable holistic medical practitioners?
Yes, yeah. You would go, even if you were looking for a general MD, you can go to the board of, the state board of practitioners, and they have their list of excellent physicians that they would recommend. And there's word of mouth. I like referrals. I like to know that somebody that I know and trust went to visit such and such a practitioner, and then I go.
Now, are there any particular credentials or certifications that you might look for, or being a member of a certain...
Just how long they've been in practice. I mean, that's a good thing.
There's nothing like experience.
Yeah, exactly. There is nothing like experience. Yeah.
And so should you look for maybe someone who takes ongoing training in their particular specialty?
The good thing is that most of the modalities require, licensed modalities require you to go through a certain amount of continuing ed units before you renew your license.
Right.
Like as a nurse, I have to have 35 continuing ed credits every 2 or 3 years. For infant massage, it requires it. For yoga training, it requires it. For Reiki, I do it anyway.
Right.
But a lot of them require continuing ed, which is really a good thing. You have to keep up on what's happening, what's changing. You have to keep up with the times. Yeah.
Things are always being discovered. There's always new information, and it's always good to integrate that.
Yeah, exactly. Perfect.
Right. And is there anything else that we haven't covered that you might want to tell our viewers about?
I was just thinking, actually, just about the self-care, which if you have time in your day, and other than the 5 minutes that I recommend, if you can get yourself out for a walk in nature, to a yoga class, to a Pilates, to a little exercise class, whatever. I find personally, when I start my day off with something physical, today I walked, by the way, that it puts a whole different spin on the day. Physically, mentally, spiritually. Walk out in nature. There's nothing like it, and it doesn't take a lot.
I agree.
Yeah.
One of my favorite places here is to take a walk in the Glen.
Yeah, I love the Glen. Yeah.
And you can hear the sounds, you feel at one with nature. And
sure. That's perfect.
And there are so many wonderful places. And actually, I agree with you. Just, getting out and moving around is important.
Get that. If you have to get up a little bit earlier, just do it, because the push, it's worth it. It is. Sometimes like, really? Just stay in bed. No.
Right.
Get to class, and it's worth it.
Yeah, well, Howard and I, my husband Howard and I, who's behind the camera here, we have something that we call the hamster walk. which is like being on a hamster wheel.
Yeah.
And that started in 2020 when we were stuck in the house.
Yeah.
And we thought, okay, we're going to just do a little loop around. And I was actually caring for my mom
Right.
at home,
Sure.
you know, and I needed
You
to do
had
some
to get
health
out.
care. I needed
Yeah.
to get out. And we just walked around and around, and we weren't really going anywhere. So it was kind of like a hamster wheel. So it was like, okay, Howard, let's go out, let's take a walk, but just a hamster walk.
Yeah, right.
And that's our hamster walk.
Right.
It's not spiritual like,
It just
you know,
feels
walking
good.
the glen.
You're just moving. You're
But-
just airing out. And even if you have like 15 minutes, then you add 5 minutes on, then you add 5 minutes on, then you add 5 minutes on. You know, you can do it like that too. Very
Yeah.
helpful. Very
Great.
helpful.
Fantastic. Great advice. Karen, I've really appreciated learning more about holistic medicine. It's so interesting to learn how holistic health practices treat the entire person rather than simply targeting individual symptoms. And your approach reinforces the notion that we all have different needs that may require different modalities for healing.
It's been a pleasure being here.
Thank you again for joining us today, Karen.
Thank you.
How can viewers learn more about holistic medicine resources and find out more information about your practice?
They can check my website. It is familywellbeingwithkaren.com.
Lastly, I want to thank all of our viewers for watching today's program. Stay tuned for upcoming episodes of Wellbeing on PKRG-TV, where there's something for everyone.